when it comes to toothache, a lot of times people tend to think that the only treatment option available is tooth extraction. They're so wrong. There is an option that you can actually do to save your tooth, and it is called root canal treatment. What is a root canal treatment? Root canal treatment is also called endodontic treatment, and it's a dental procedure that involves the removal of the soft center of the tooth called the pulp, which may have become infected either due to dental cavities or trauma. The tooth crown now is actually made up of an outer layer called the enamel, a second layer called the dentine, and the middle layer called the pulp. Now the pulp contains the nerves and the blood vessels, and this pulp actually extends from the crown all the way down to the root through the root canals. Once dental decay or trauma affects the pulp, the early stages of tooth infection begin, usually starting with pain, and if left to progress without treatment, it can actually get to a point where the tooth becomes infected, leading to pus formation, or what we call an abscess. The main aim of the root canal treatment is actually to remove the infected pulp, treat the infection, and that way you have a chance at saving your tooth. So what are the signs and symptoms that indicate pulp damage? The first would be persistent toothache. If you've been experiencing toothache, especially the throbbing kind, it's possible that whatever the cause may be, whether due to a cavity or trauma, the pulp may have already become affected. Sometimes this pain can be localized to the particular tooth being affected, or it can actually radiate. And when it radiates, you can actually feel like other teeth are painful, or it can radiate to your ear, causing earache, can radiate to your eye, causing eye ache, and even give you associated headache. Prolonged sensitivity to heat and cold stimuli. Now usually when we talk about dentine hypersensitivity, we call it a short sharp pain, so meaning it is of a short duration. But when you have extended periods of sensitivity, especially when it lingers beyond a certain point, and you have discomfort when you bite or chew, there are chances that the pulp has already become affected. Gum pimple or a gum swelling. When a tooth becomes infected, it can actually get to a point where you have pus formation or abscess, and this leads to the gum being swollen, tender, and puffy. Sometimes this accumulated pus may not drain at the point of the infection. It may actually collect into spaces within the jaw, leading to a jaw swelling. Tooth discoloration. Now when there's been a history of trauma to a tooth, the blood supply can be cut off, resulting in pulp damage. As the pulp becomes infected, the tooth can end up becoming discolored. Also, trauma can also result in a chipped or a cracked tooth. You may have a cracked tooth as a result of an accident, or while playing sports, or maybe even while biting on something hard. That's one of the reasons why we advise against cracking of bones and cracking of ice, because this can actually lead to a cracked tooth. Now with a crack, the crack line actually extends from the enamel to the dentine and all the way down to the pulp. Now if the crack extends to the pulp, you have an opening where bacteria can actually seep through, causing an infection. So how is the root canal treatment performed? The first step, of course, would be to visit a dentist that actually carries out this procedure. Now once you visit the dentist, a general examination will be done, the tooth will be assessed, dental x-rays will be taken so that a diagnosis can be gotten. From this diagnosis, it will be known if the tooth can actually benefit from a root canal treatment, and if yes, we begin. So the first step to this will be to anesthetize the tooth. What I mean by that is to numb the tooth. A numbing injection will be given to you. The reason for this is to prevent any pain you may experience during the procedure. I know not everybody likes injection, but this is a necessary step. Now once the tooth is numb, the next step will be to get access into the pulp layer. If there is an existing dental cavity, the dentist will go through that dental cavity. But if there is no existing dental cavity, such as when you have dental trauma, an opening will be made into the tooth. Once the infected or damaged pulp is exposed, access into the root canals will be done with a special tool we call dental files. These dental files are especially useful in cleaning out the canals and removing the nerves. Once the pulp has been removed, the canals are then cleaned properly and irrigated with an antiseptic solution, after which a medicament is placed directly into the canals to treat any occurring infection. Now this step of cleaning the canals, irrigating, and placing an antibiotic medicament can actually span between 2 to 3 appointments. The reason is you want to make sure that every infected pulp tissue is removed completely, every infection is cleared before the final treatment. For more infected cases, it can actually even take longer to complete. Now once the root canals are cleaned and disinfected properly, they are dried off and then filled and sealed with a root root canal sealant called gutta perca. Once the root canals are sealed, the final step will be to restore the tooth. So an appropriate dental filling material will be used to fill up the dental cavity. To help control any post-operative pain as well as infection, you'll be placed on some oral antibiotics as well as some pain medication. The root canal treatment should not affect your day-to-day activities, so you should be able to resume your normal daily routine. Just make sure to avoid chewing on the area being treated until the final restoration is placed or until the dentist tells you to do so. Depending on the extent of decay or trauma prior to the root canal treatment being commenced, there is a chance that you may need an extra step, and that is a placement of a crown. A crown is like an external covering over your tooth to give additional protection to it. So what happens after a root canal treatment? Root canal gives you a chance to actually have your teeth in your mouth as against extraction. Your root canal treated tooth can actually last as long as possible. It can last quite a long time, but still it depends on your habits and you following the post-op instructions, as well as how you take care of your teeth. So just as the rest of your teeth depend on good oral hygiene practices, your restored teeth also require good oral hygiene practices. Habits like cracking of bones and cracking of eyes are really detrimental to your dental health. Your teeth can actually crack off. If your teeth can crack off, it then means that a filling can also crack off. So making sure you avoid using your teeth for things they are not meant for. This is something that is very important. If you follow these instructions, there are chances that your teeth and your fillings can last quite a long time. When it comes to dental issues, prevention is always the best. It is better to prevent yourself from having dental issues than to go about treating them. Ways to prevent toothache will be making sure you are brushing properly, brushing at least twice daily, and flossing at least once a day, attending regular and routine dental checkups so that professional cleaning can be done. And not just that, a general oral examination will be done so that a proper assessment will be done on your teeth and your gums to know if you have any developing cavities or gum problems. The most important step will actually be having a healthy diet. If you tend to take a lot of sugary things like sodas, refined carbohydrates, candies, all these are filled with sugar, and sugar is the main culprit in causing dental caries or dental cavities. So you need to actually limit them. If you can stop, better, but you can also limit them and make sure that you stick to more of a healthy diet. Fruits, vegetables, nuts, all these are healthy. Switching to a healthy diet will actually be good for you and not just your teeth, your overall body health. So if you have toothache or you know someone that has toothache, there are chances that you can actually save this tooth with a root canal treatment. Visit your dentist, let a proper assessment be done to know if you're a good candidate for the treatment. That way your tooth can last for you as long as possible. That being said, we've come to the end of this video. Please give a like, comment, share this with someone, and also subscribe. That way you get notified when I post new videos, and I will see you in the next one.